Hello, welcome back to another important session. In this video, we will be talking about core concepts in geriatric care. This explains the biological and functional foundations that make older adults vulnerable to illness, injury, and poor outcomes. Rather than focusing on disease labels, the session examines aging physiology, frailty, sarcopenia, reduced reserve, vulnerability, and resilience. These concepts explain why minor stressors can lead to major decline and why recovery is slower and often incomplete in older adults.
Last session, we discussed the normal range of vital signs in geriatric care, such as body temperature, blood pressure, heart rate, respiratory rate, and orthostatic hypotension. By the end of this video, learners should be able to 1. Explain normal aging and distinguish aging-related change from disease. 2. Define frailty and identify early signs of frailty. 3. Explain sarcopenia and its impact on function and outcomes in older adults. 4. Describe reduced physiological reserve, also known as homeostenosis, and how it limits stress tolerance. 5. Explain vulnerability and resilience, and apply functional status as a clinical tool for anticipating risk. What is normal aging? Normal aging involves gradual changes like reduced muscle strength, slower balance and reflexes, reduced organ reserve, slower healing. These changes are expected but reduce resilience. The body still works, but it has less backup power. Next is frailty, the central geriatric concept. Frailty is a state of increased vulnerability where small stressors cause disproportionate harm. The key features are weakness, fatigue, slowed movement, reduced activity. Frailty explains why mild infection causes severe decline, and short bed rest causes loss of independence. Frailty explains why mild infection causes a severe decline, and short bed rest causes loss of independence. Having seen what frailty is, let's look at sarcopenia and why it matters clinically. Sarcopenia is age-related muscle loss. The consequences are falls, mobility loss, prolonged recovery, institutionalization. Muscles are shock absorbers. Aging thins them out. We will move ahead to see what reduced physiological reserve means. It is also known as homeostenosis. Reserve is the body's ability to respond to stress. With aging, reserve narrows. Compensation is limited. Collapse can be sudden. Another concept in geriatric care is how vulnerability, resilience, and functional status can help predict risk. Vulnerability increases with frailty, multimorbidity, polypharmacy, cognitive impairment. Resilience is reduced but not absent. Early intervention can help. Now, let's see functional status as a clinical tool. Function integrates multiple systems. Functional decline often precedes abnormal labs, vital sign changes, diagnostic clarity. In summary, normal aging involves gradual changes such as reduced muscle strength, slower reflexes, decreased organ reserve, and slower healing, which reduce the body's resilience. Frailty occurs when this reduced reserve makes older adults more vulnerable, so even minor stressors can cause significant decline. In addition, age-related muscle loss, known as sarcopenia, and reduced physiological reserve increase the risk of falls, slower recovery, and functional decline. That's it for this session. See you in the next video. Bye for now.